the sacituzumab approval that we have based on Trophy is post-chemo, post-immunotherapy. So we don't really know how sacituzumab performs from trial data post-EV Pembro. There is an ECOG trial right now, which is looking at a regimen versus physician's drug of choice, which includes sacituzumab. And as was alluded to, we have the Tropics-04 press release, which is telling us that it's negative OS for sacituzumab versus physician's treatment of choice, which generally were different types of chemotherapy. So I'll be interested to see when those results read out. But in terms of where it fits, I mean, the options really for FGFR negative patients are either chemo or sacituzumab, I suppose, can still be considered. I think something that's really important if sacituzumab is considered, for whatever reason a patient can get chemo if they have bad neuropathy, is to provide primary G-CSF prophylaxis, because we've seen a really high rate of neutropenia and febrile neutropenia, and even in some of the trials, deaths related to febrile neutropenia. So there was a trial presented today at ASCO for perioperative sacituzumab, and they actually dose reduced from the 10 milligram per kilogram to 7.5, and they added primary G-CSF prophylaxis. I think another thing to consider is the UGT1A1 polymorphism in terms of potentially predicting which patients might be at a higher risk of toxicity. And so those are all things that I think come into consideration if someone were to consider sacituzumab.